Good afternoon and welcome to AI ROI and Health Systems, use cases delivering measurable value in 2026, a health system CIO production. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we'll take them later in the program. Just so you see how we're going to spend our time today, we're going to go about 35 to 40 minutes with our main panel discussion featuring Shakeeb Akhter, SVP, Chief Digital and Information Officer with Children's Hospital of Philadelphia, and my longtime friend David Chou, a seasoned and experienced health system IT executive. And then we will have our audience Q&A. So let's jump right in. Shakeeb, let's start with you. Do you want to give us an overview of your organization and your role?
Sure. Thanks for having me, Anthony. At CHOP, we're the first children's hospital exclusively dedicated to pediatrics, and to have around 31,000 folks within the organization, and have three hospital locations, largely based out of Philadelphia. We have one exclusive hospital for behavioral health, and about 36,000 admissions. And millions of outpatient visits, around 1.7 million outpatient visits a year, 700 plus beds in use. So that's kind of the relative size. In terms of my role, I'm the CDIO here, so all things digital technology, infrastructure, applications, data analytics, AI automation, and we'll talk a lot about today, along with cyber and others. So organization for DTS looks around 600 FTEs, 700 FTEs or so, but runs the gamut of all things data, technology, application, informatics, and now research, which we also just recently kind of centralized within the central team.
They always seem to give everything to IT, right,
Yeah.
Shakeeb? They just throw stuff under it.
Somebody's got to integrate and deliver, right?
There
So,
you go. There you go. All right, David, you want to tell us a little bit about some of the kinds of organizations you've worked at and some of the roles you've had?
Yeah, so I would say I've been fortunate to be in various types of organizations that range between 500 to 25 billion plus in gross revenue. I've been at a standalone pediatric facility just like Shakeeb, so happy to share what I'm seeing in the industry in terms of everything that we're talking about, whether it's AI, automation, anything.
All right, very good. Thank you. All right, so let's start. How are health systems defining ROI for AI right now? Is it mostly financial, or are organizations building measurement frameworks that also account for clinician experience, time savings, and patient outcomes? Shakeeb, let's start with you.
I mean, I think the answer, in terms of Dave's answer too, I think the answer is they are defining. How they're still in the definition phase of how to measure ROI. I think we all are. No one's figured this out yet. We're thinking about it a couple of different ways. One is clearly time saved. Is the ROI time and efficiencies back, or is it financial? I think number one has been time, especially if you saw like Ambient Scribe, which took over, for a couple of years now. We're really saving clinician time so they can do things that are highest value. So that's one. We measure all of that with our AI work, and then we try to put a ROI in terms of efficiencies, labor generated savings. Two, I think, is financial. So, very large focus on revenue cycle. I think most people are very aware of this. AI and rev cycle is a large opportunity. And so we're looking at that as automating prior authorization, predicting denials, reducing denials, increasing cash collection. Those are some of the financial ROI metrics we're looking at. And then we are measuring kind of both staff and clinician experience. So how is it? Not every dimension of ROI has to be financial. I actually think part of it is we have to figure out, are we improving the experience, not just for staff, but also for clinicians? We're looking at class metrics for that. Is there a reduction in burnout for clinicians? Is there a better satisfaction with the EHR, for example? Those types of things. And then last, on the patient outcomes, I think it's way too early for that. For most organizations, we do not have patient outcome metrics just yet for two reasons. One, we're pediatrics, so we're specialized. And most of the AI algorithms that are being built in the industry are not pediatric specific. So we have to actually either develop those algorithms ourselves or co-develop them with a partner. and that's going to take some time to do. So while we're focused on that as an area, pediatric diagnostics, for example, doesn't exist today, powered by AI. But we're doing some work in pathology and radiology, but too early to say that we're going to be able to impact outcomes for patients just yet.
Okay, very good. David, let's look into that a little bit. Um, we talk about defining ROI. As an IT executive, I suppose you can come up with any definitions that you feel are appropriate, things you want to include. But what do the CFOs want to see? I mean, if you say, "Hey, I'd like to factor in time saved and whether or not clinicians feel good and are enjoying their family, I'm going to put that in." The CFO may say, "Yeah, well, that's great, but I don't care that. Strip all that out and give me more of the revenue cycle management stuff, the hard dollar stuff." So, how interested are CFOs in some of these softer metrics? Are they willing to listen, or do they take this stuff seriously, so to speak?
Wow, you make it seem like we're good salespeople, huh? We're just trying to sell used cars to make this
Yeah,
ROI look pretty. That's part of the battle, right? Um, the soft ROI is not real, in my opinion.
it's
We
not
get
real.
these because we get it from the vendors. You can't measure it, right? Sometimes the ROI. Let's use something you mentioned earlier about Ambient Scribe. What's my ROI? The ROI is have this doctor stop screaming at me for being inefficient with the system. That's my ROI. If they're happy, I'm happy. Organization is happy. They could potentially be a lot more productive in providing care at the best of their capability. So sometimes those are the true ROI. It is not tangible, right? You hear about the ROI from every vendor that tells you we're going to be able to save 7 minutes per patient by using our ambient scribe. Well, I guarantee you they're not going to give you $7 in the physician's time back in terms of um, any dollar amount, monetary value. So that ROI is just, you know, it's not as hard as what people make it out to be. But the problem is we have to use that number to sell it internally, and then the CFOs have to use that number to sell it to the board and so forth. So there's time when we use a lot of these soft numbers to justify, but a lot of the time is really how do you get human behavior to be a lot more efficient as a true ROI. And then when we talk about the rev cycle stuff, I think there's a lot more tangible there, right? If you're able
Yeah.
to automate, whether it's getting folks eligible, right?
Mm.
Eligibility is one of the hardest factors to do. If you're able to get folks eligible, that means they're able to get coverage, you're able to get reimbursed, at the same time provide something great for the community in terms of getting care. So I think there's more tangible ROI on the financial side, on the call center side from AI perspective, but on the clinical side, it's still very hard to justify. But it does bring satisfaction, it does make people feel good. So for me, that's the ROI in itself.
Yeah, that's brilliant, David. I mean, I think that it's just fascinating. It, you have these physicians that are extremely influential in your organization, and their opinions matter and carry serious, serious weight. And if they're happy with some of the tools you've given them, like there's not much else you need to like. That's got to justify it, and you can tell that to your C-suite colleagues that hey, Doctor So and So and Doctor So and So, they love it, and that could be enough of a study and a research and metrics right there. Is that correct?
That's how I look at it, right? Sometimes people ask me, what's the ROI? For me, it's Dr. A, our
Yeah,
most highly productive
right.
physician, just being happy.
And
Yeah,
I think it's a
Shakeeb, what do you
mistake.
think?
Yeah, I agree. And I think it's a mistake and a trap to think that everything is going to have a provable financial ROI. I think that is kind of a fool's errand. I think you're going to have a mixture. And we've talked to our executive team and said not everything needs to have a dimension of financial ROI. There are things here that make the patient experience better, that make the clinician experience better, that make people happier and more productive. Those are worthwhile because they show up in other ways.
Yeah, well, Shakib, let's get a little drill into that a little more. So there's one end of the spectrum is I did a survey of our users and I have metrics and sort of quality numbers and we can trust these numbers versus on the other end is a few anecdotes. Now, depending on who those anecdotes are about, again, those super influential clinicians, that can be enough. But between hard numbers on the clinicians enjoying this and sort of a couple of stories, is there somewhere as a CIO that you're trying to gather that information so you can bring it to the CFO and say, hey, I've got a little more than one or two stories to tell you about how this is making very important people here happy?
Yeah, well, I think there's two things, as one is the CFO is not your only stakeholder. And they're not the only person that you need to prove ROI to. Like for us, it's the COO as well. And so there are operation and the chief medical officer. So
Right.
you have kind of a three part triad for sponsorship of the AI strategy. You've got different stakeholders that are looking for different types of value, and that conversation happens organically. It's, well, CFO may see one type of value, which is only financial. CMO is going to see better well-being, better productivity. That's a part of their mandate to drive for the physicians. And so they're going to push for that type of tool, which I think is very helpful. The operational COO is going to look for operational efficiencies and how that's driving. And so I think having at least 2 to 3 leaders co-sponsoring this strategy with you as a CIO is really important. So you're not the only one talking about value in a single dimension, and there are multiple people behind the plan. And then in terms of, whether it's anecdotal or it's hard metrics that are proving value, I do think, that, if you look at 2 years ago, it was all pilots. We're piloting this from
Right.
Ambient, we're piloting this epic AI, Gen AI feature, et cetera. I think people are looking for actual value, or they're looking for pilots scaling across the organization. So I think early on, a couple of years ago, it was okay to have some anecdotes and say, hey, people really love this. I think what I'm hearing from our organization, and I think many others are, is we need to go from pilot to scaling. And so, picking on the Ambient, for example, we started with a small pilot of 30, 40 docs, doing across specialties in primary care, got the anecdotal stories that then said, okay, great, let's try to scale this across the board and sign an agreement for the enterprise. And that has to show value with hard metrics, right? Same is true for Epic Gen AI features, like the things that we're looking at, whether it's node summarization, et cetera, or automated prior auth. We are looking at all of those things to say, yeah, it's great if it's a pilot, but you need to show value at scale. And that's going to have to be hard metrics around that.
All right, David, let's go to you, but I want to dig into this issue of pilots. Help me understand, because I don't think I quite understand why a pilot could be successful and fail to scale. I mean, are we talking about the application in and of itself can't handle the volume, or I think more likely we're talking about operationally it worked in one area. Maybe you think it's going to be apples to apples, but it isn't. And it worked in one area, but it's not going to work in other, maybe not without a lot of customization. So um, you're not taking into account how much work it's going to take for each iteration of it. Anyway, your thoughts on, have you seen this? I would imagine pilots that seem to work not scale, and then does the whole thing die, or it just continues to live on where it's scaled well? Your thoughts, then we'll go to you, Shakeeb.
Probably, I would say a lot of pilots. Shakeeb mentioned something that's really critical that no one really digs in on, which is CIOs do not have the power to do everything, and sometimes have no power at all. You may think you have the budget, but you don't have no budget. You don't have the authority. You got to bring in all the stakeholders. So all the glamorous CIO that you hear about that says, "Oh, I have the power to do X, Y, and Z." That's BS, because we all have to have all the stakeholders aligned. We're selling this across the board. So a lot of pilots fail because you probably have one hero that's going out there, that's making a deal, getting a smaller piece of the contract, going through a quick approval process and using it in a small area that's contained and confined. But it may work well, but never got the buy-in from the rest of the departments, the rest of the senior leaders. So that's one area where it may fail. The other is you may have the flip side, departments that goes out and buys their own stuff. Lots of great departments, pediatric world, the cardiologists, pediatric cardiologists, they own that space. They could go buy anything all the time. They have budgets. They could go around the CIO. They could go and pilot something. But if they don't get the buy-in from the others, it may fail too, may not scale. So a lot of times it's not the product. It's really the inability to influence quickly across the organization and navigate. Therefore, it doesn't scale. Most products work. If you think about almost every product that's commercial product that we use in healthcare. Most majority of healthcare organizations buy commercial off-the-shelf products. They have already been designed to scale.
Right.
They have clients that are bigger, and so they're going to work. But the inability to influence, that's the hardest part for the CIO job, right? Our job is really internal selling, external selling, upwards, downwards, across the teams, right? If you think about the team that's helping you implement, if you don't get their buy-in, I mean, these are staff members that report to you. If you don't get them bought in to help you deliver this appropriately, it's gonna fail. So think about how hard the job is now. You're just cross-selling upwards, downwards, all over, just to be able to influence this vision, this idea, and enforce it to make it happen. So a lot of times when you miss a few components of those, it doesn't scale. Really nothing to do with technology, more on the human side.
I think you just made me understand it. You explained it to me, and I finally get it. And I finally get it because I'm picturing a departmental initiative. Hey, we like it. We helped pick it, so yeah, we love it. And now you're trying to roll that out. So you're giving it to departments that were never part of the original selection process. They weren't consulted. They didn't say we want it, but you're trying to scale it, which means spread it. And they're like, no, we didn't ask for it. We don't like this one. We'd probably pick a different one. Shakeeb, am I getting it? Am I finally understanding?
Absolutely. Yeah, David's spot
Oh,
on. It's like I wasn't involved in the process. I don't know why we're doing this.
right.
My operational processes are completely different than Department X that, brought this in. The way I document may be significantly different. The workflows are different. So I think there's like operational process management. And the last thing I say is everybody's really busy. And so
Yes.
you need, in order to implement an AI solution well, clinicians at the table to help
Yes.
design the workflow if you want it to adopt and scale. And I think that, like David said, if it's IT driving that bus, I think that you're going to run into a lot of potholes and eventually fall off the cliff because you really need people fully bought in, championing this alongside with you to make it stick.
Yeah, it's interesting, Shakib. So you have initiatives that sort of bubble up from the departmental level, right? They want it. They want a solution. Maybe they want a particular solution. And that seems a little bit easier to me to you can partner with them on that. You could support them. They're bought in already because they came to you. But I imagine in other areas where it's more of a top down or perhaps scaling out from somewhere else, that's when you're like, okay, we got to get everybody on board before we turn anything on. I have to sell, right? I have to sell. I have to communicate. I have to share the value because I've been tasked with getting this to be used in this area or in many areas. As IT, I've been tasked. So I have to get them to want it, right? Am I thinking about this right?
My philosophy has always been never lead with the technology. I mean, if you're looking for a shovel to sell people, it's going to be really difficult. I think it's going to be have to backwards. What is the pain point the business is trying to solve and work backwards? So, we all have applications now within our portfolio that are churning out AI solutions every day of the week, whichever your favorite platform is, right? In terms of EMR, ERP, your orchestration layer, hundreds of features coming online literally every week. And so you are not going to be able to sell all those, nor are all of those going to have material impact on your particular organization. So the question really is that the right strategy? Or is the strategy, hey, what problems are we trying to solve in revenue cycle, in supply chain, hard dollar ROI areas like David mentioned? What are the problems that we're trying to solve for the clinical workforce? Where are they struggling? And sometimes it's not AI, right? It's just like basic process reengineering, technology, and good implementation and training. So we're not focused just on AI for the sake of AI. I think it's going to become a utility like everything else. It is good problem definition, opportunity identification, process reengineering, training, adoption, and scaling. Like everything that's been true for technology solutions for years in terms of implementation is also true for AI. I think what we're seeing though is we're getting, it's cross-cutting all industries and everything people do simultaneously, all at once, right?
Right.
Not just it can't be contained. It's more like electricity. It's everywhere all the time. And so you have to really manage that message and then get clear on the problems that you're trying to solve.
Right.
and then figure out which AI solution is going to best solve for that.
David, what are the expectations of IT executives right now when it comes to AI and these technologies? Even though Shakeeb said it's not always going to be the solution or what's needed, I feel like there's pressure probably being put on you folks to make sure we're using AI. Make sure we're almost in a panic, in a frenzy. Make sure we're using AI. And I'm not saying that's completely wrong, but it does probably skew. You need to show you're rolling out AI and people are using AI. So, what are your thoughts on that dynamic? Is that accurate? Is that what it feels like?
Oh, definitely, right? If you look at what's going on in the stock market, right? Organizations are downsizing because people believe AI is going to displace humans,
Right,
right? CEOs think they could be more efficient by having AI technology. Well, they may not know exactly which AI technology
right,
or what is it doing, but they're hearing the buzz from everything that's in the media related to AI being the next greatest thing, and it is, right? When I think about the tools I use personally, I probably
right,
use all four just to
right,
do one task, but they're
right.
all very unique. So at various organizations, they're looking for ways to utilize AI to help their staff be a lot more efficient. Forget about the clinicians. Let's just talk about administrative staff,
Okay.
right? How much time are you spending on emails? So let's say you're a Microsoft shop or a Google shop. Are you using the built-in AI tools that's deployed to ask the simple question? Oh, summarize this email topic for me that's been going on for 3 weeks. I just need the key highlights. Give me the main bullet points that I could share as output. Or, hey, look at my calendar. Where is it not efficient? Do I
Right.
have too many useless meetings here? All these little things, people can ask these types of questions now using AI tools embedded for something as simple as email to think about how they can be more productive. Now, does everyone use it that way? Maybe, maybe not. But I think that's the aspiration for CEOs to think about, hey, if I put this tool out there, I want my team to feel like they could use it and be more efficient. But you have to be really accurate in terms of your question. You have to think appropriately in terms of these tools. There's not a button to push. So I think because of the narrative of AI helping organizations be more efficient, it's a potential way to lead to additional revenue. It is top of mind for CEOs. So then CIOs are under big pressure to deploy some sort of AI solution, but not knowing the type of impact it'll have because we're still sort of early, but they know it could help people. So now, how do you cascade something as simple as what I just described in terms of being more efficient within your email and office ecosystem? How do
Yeah.
you cascade that down as an education to every staff member? Hey, you have this tool now. It's going to help you be more efficient. Lots of education need to happen, and there's got to be a proactive side from an employee standpoint to learn these new features. So I think just that combination drives a lot of pressure for even something as simple as what I described that's not even clinical related, right? So imagine
Yeah.
what happens on the clinical side, the amount of tools that they have, how are they going to use that to be more efficient? It's just everywhere.
Shakeeb, any thoughts there?
Yeah, I completely agree, and I think I like the Microsoft example a lot. It's embedded in your tools. I think one of the things that we're doing is um, embedding Copilot chat, the free version on all the shared workstations, like a step one. That's a no-brainer. It gets that tool in everybody's fingertips all at once. Always helps that it's no additional cost, right? And so you can scale that unlike other parts of Copilot. So we've done that. That's great. And then we created an AI literacy program to say, hey, let's just teach you how to use these tools. We're doing AI hackathons. So I think it's making the product available, but also creating awareness on how to use it best. And, we've created tools, like David said, trainings around how do you prompt effectively. We've done hackathons around that. We have the courses available through Workday for all employees. And we have about 9,000 people that have taken these, like Introduction to LLMs, Intelligent Automation, kind of this 101. And now we're creating a 201 and a 301 for more experts. Not everybody needs to be an expert in using AI, but I think to cover the masses, you probably just need to teach them the basics. So I think there's this kind of two things happening at once. You need like generalized AI available to a large number of people to make them more efficient, like David was saying, and then you need to couple that with training, right? And then you have the specialized AI for people, and then a specialized access for people with deep expertise. We're a learning institution, so we have a research institute of a lot of fantastically brilliant MD PhDs who like to code and will build things, and a really great informatics program. Those folks need access to the models to build applications. And I think that is going to be the key. How do you empower your clinicians that have deep clinical knowledge with the training on how to use these models to build new applications, new algorithms, et cetera? So we're doing that too, but that's probably 10 to 20% of our population max, and everything else is more generalizable. So and also, we are also measuring adoption metrics, for Copilot, for example, and other tools that are generally available. How effectively are people using it? If they're not using it, can we do more targeted training and follow up with them? So the last thing I'll say is we've started to ask people to build their departmental AI plans. Because again, centralized AI IT groups cannot do that for everybody. We can create a centralized AI strategy for the entire organization, which we are doing. And that's more of a top-down view based on ROI and areas of focus. But then we're saying, hey, each department carry this out within to build an AI plan for your department as the leader there with your teams. And here are the tools and frameworks to be able to do that.
That's very good stuff. So a couple things is we want to roll out some of these productivity tools. We want to make sure we've got things turned on and people have access. I would imagine we can discuss this a little bit, but we want to make sure they understand what are safe sandboxes, what are sanctioned sandboxes, and what aren't. Is what's on my desktop at work, the Copilot version there safe for me to put in any kind of data I could access, or there's certain kinds of data I can put in here, certain kinds I can't. Are there certain things I can take home and do on my personal account versus I can't? Or the governance around data going into an LLM, right? So we give them the tools, we let them understand what kind of data they can use to interact with the tools. And then we want to make them literate on these things. Shakeeb, you talked about developing these courses. Let me start off by asking you, what's IT's role in developing these courses? How much input do you have or involvement?
For us, we had a history of, I used to lead data analytics here at Shop. So we created DNA University at the time, and we took that same methodology to AI learners. So you create a school of AI. It is largely our team that is building those.
Okay.
Our AVP of data science or chief data analytics officer, we're building those courses. I think, but you don't necessarily, we're building them, we're building some of the courses. We're also leveraging a lot of our partner education. We don't need to build everything ourselves. So Microsoft Employee Skill Initiatives, we're using that. We use other tools that we're using their training courses to begin with. I do think, similar to analytics, at some point you will want clinicians teaching clinicians because they'll have more context
Uh-huh.
and be able to speak in the language of the work that's happening. Same with nursing. And so part of it is, can you get somebody as a champion? We did this with EMRs, right? We've done this before. EHR champions, et cetera. Take that same playbook, train clinicians on AI, have them deliver the trainings specific to their specialties. So I think that's the next step. And in analytics, what we had done here is have clinical analytics champions who then create the content for their particular divisions. I think we'll take the same approach here.
David, question for you. I find this to be a really interesting area, but I believe, and I'm sure I'm not the only one, I've probably read this in many places. I believe that organizations are going to start or have started uh, observing their workforce in terms of their willingness to learn and these tools and participate in these educational programs. Um, I think organizations either have or will, and I think you will see a divide between those that are receptive to this kind of education and using these tools. You mentioned a CEO sitting there saying, I know my workforce can be more productive if they use these tools. Therefore, I want them to use these tools. And if I have components of my workforce that are refusing or laggards or not engaging, I'm not sure that's the part we want to go forward with. Do you feel like organizations are going to start keep sort of being observant, keeping that kind of information? Do you think we're going to see you're either in or you're out with this stuff? If you're out, you're in trouble.
I think it'll be part of basic competency, right? You think
Right.
about it, right? People's job description, some still say office skill
Right.
set, right? Same's
That's
gonna
the
happen
best.
here, right?
That's the best.
Same's gonna happen here, in my opinion, right? You're gonna
Yeah.
have some
Yeah.
sort of competency that
Yeah.
you gotta be able to use these AI tools like office skills. So
Yeah.
eventually, people are gonna get weeded out, right? If you're in the late stages of your career in life, you don't want to learn new
You're
stuff.
right.
I
You're
mean, if
right.
I'm at that stage, I'm done.
I'm
I would be on
done.
the golf course. I would
Yep.
go hang out. I'm not gonna learn Gemini, Open AI, Claude, all these things. No. So I think that divide will happen. There are people that's going to weed themselves out. And then, when I look at my kids, they use 2 or 3 for school right now.
Right.
Sometimes they tell me, hey, dad, I need a paid version. I got to be able to pass this test. The
Sure.
paid version thinks a little bit better.
Yeah.
So they know how to use these tools. And
Yeah.
sometimes I'll check on their prompts. They're asking some really good questions
Yeah.
that I'm surprised. So I think the generation, kids that are in school now, I have a high schooler, they're using it as part of their daily routine. So just imagine when they get to the workforce, this will be like if you don't have these tools, they won't know how to really navigate a
They
work
won't want to
environment.
work there. They won't
Yeah.
want to work there. It would be
So,
just like the physicians now coming out of school. If you don't have a top level EMR, or the tools, whatever tools they trained on in school, they're not going to want to work there. Shakeeb, we went very quickly from if you're using AI, you're cheating. Either whatever you're doing, if you used AI to do the thing, you're cheating. To if you didn't use AI to do the thing, it would have been a lot better if you if you did. So that went fast. But now you got to use it well because you don't want to, whatever you're doing, you can use it poorly to where it's just not a quality, sophisticated output. So there's different levels of using it. You're not just using it, you have to use it well.
I agree. Yeah, I mean, I think that's why the training is so important that we
Yeah,
were talking about earlier. You have to train people well. The quality of output is as good as the input.
right,
The garbage in, garbage out, right? I mean, that's the
right.
phenomenon. I think that's why we're paying so much attention to teaching people how to use this stuff effectively. And it's not like any other technology where it's a discrete, same answer, the correct answer every time, right? It's probabilistic, not deterministic. So I think that's the big change for a lot of people. That's also why we're always saying human in the loop, no matter what. You
Yeah,
have to have that. You have to have somebody reviewing and be responsible for the AI output and don't trust blindly. For that, I'm sure a lot of other people have also done this. We have a very, well-defined AI use policy for folks. Like here's how you should use it, how you shouldn't use it, the pitfalls, and what you should be aware of in terms of hallucinations and confabulations, kind of educating some of that in the structure so people don't blindly trust it. I think it's really important. My son had an example. We were looking for this past weekend, we were looking for a place to have him and our other kids play while we were going to the mall here.
yeah.
And he's like, oh, I was like, let's just ask Claude, and Claude said there's a place called Kidham that's 5 minutes away and it's great and all the kids have so much fun and 4.8 stars review. I'm like, I've never heard of this place. Why don't you Google it and then call it? And he goes, Dad, that place doesn't exist. It's not in Google. I'm like, oh,
It just
great
made it up.
teaching moment.
Yeah.
Claude completely made it up. And, regardless of model, that's happening all the time. So you have to verify the output. But I thought that was great.
I was
Great
I
teaching
was
moment.
I was trying to get it to help me. My rain sensor's broken on my sprinklers, so I was trying to get it to every morning tell me if I need to water based on how much rainfall we've gotten and all this stuff. And it kept telling me you don't need to water. You're good. You're good. And I'm like, I think I need to water. And it's like, no, you're good. The high's going to be 60 today. I'm like, the high's going to be 95. What are you talking about? And it does that apology. I'm so sorry. You're right to push back. I'm like,
Yeah.
what's wrong with you?
Yeah. Yeah.
So it's more amusing than it. But yeah, you wouldn't want to be using it clinically and have something like like that come up.
No, and that's why I think part of what you asked about the patient outcomes piece, I mean, we have
Yeah,
to start with the low risk areas as the technology gets better. And so I think it's gonna be wild as you see Gen AI specifically for clinical decision support or, taking over some aspects of clinical care that's just too high risk.
right, right. Let's talk a little bit about we're doing a webinar on this in a couple of weeks, but the idea that the tools out there make building software much more much more easily done than it used to be in the past. And before you sort of had this classic decision point where if a new application was requested, you could either get it from your current EMR vendor if it was in the platform, or perhaps a niche vendor if the current platform offering wasn't up to what you feel you needed in terms of sophistication. A lot of people would say, okay, we'll do that. And then as soon as they get up to snuff, we're going to get off this niche solution. I've heard a number of very intelligent people say there's now a third option, which is build, and some of the tools out there make building software much more viable. So I'd like your thoughts on if you're seeing any of that, and what your thoughts are around that. David, you want to go first?
Yeah, who's telling you that? I would love to hear. I would love
I,
to
I'll
talk to
play
that
you the
person.
clips. I'll play you these are smart. Who do you think I'm talking to? I'm talking to smart people. Trust me.
I'm about to call them out.
All right. You're
No,
not a builder.
well, the most organizations, they don't have the skill sets internally to build,
Yeah.
but not to say this tool sets can build so much better now, right?
Yeah.
You could put the prompts in to build the software. I think people have the aspiration to do that. I don't think it's reality yet. I think to be able to build it, you could build your own sort of micro system,
Right.
but healthcare is still difficult because it's so closed. So,
Uh-huh.
okay, you build this great system, but you can't integrate with something else, then you're kind of stuck still. But I think the aspiration is there. I think the model is there to do that. I don't think it's as real yet until we get to the point to where we could just exchange data a lot easier. I think we're still struggling as much as we have progressed a little bit. It's still very hard to do in terms of building software that's able to integrate with others easily within the healthcare provider space.
Right. So a big difference between building, using OpenClaw to build some kind of agent versus some sort of commercial grade software that's secure and HIPAA compliant and
Yeah.
all this stuff. Shakeeb?
Yeah, I completely agree. I don't think software development has ever been a strong suit for healthcare provider organizations. And I think that with AI, yes, it becomes easier to build with these tools, but it's very difficult to find the talent to build something novel. And so I think our software developer folks are starting to play around. Now there is a consideration of, ChatGPT for health, and as these models start becoming releasing products that are healthcare specific and HIPAA compliant, et cetera. I do think there's a world that you could build little GPTs or LLMs for narrow specialized areas. We've started doing that, like our policies and procedures. I mean, I don't know, David, if you use Policy Manager, we use that system, and it is very painful to try to get access to policies. And so we're saying, can we build an LLM to help find it and put the fingertips to, again, save time, like we've talked about. It's challenging to do the grounding for the LLM to get the repeatable response. So team is working a lot on that. I think there are areas where we could do this effectively and build solutions that are niche. I think it is not enterprise grade software they're going to be building, because then you have the cybersecurity, right? With OpenClaw, you have cybersecurity challenges you have to solve for. You have integration challenges with other systems you have to solve for. So I think it will happen. It'll happen slowly, and it'll happen in very niche areas over time.
All right, very good. I'd like to give you two an opportunity to ask each other a question. I would suggest make it something you're thinking about, pondering, curious, and I'd love to hear you guys help each other out. So, David, a question for Shakeeb?
Ooh, I gotta get ready.
Yeah,
Ooh,
see,
question.
David, you're on the spot. Shakeeb gets a minute to think.
I know. Well, let's just hear, Shakeeb, what's the top priority in the pediatric space for you guys? Outside of technology, right? Where's your big focus, and then where does your tech come in?
Yeah, I think for us, there are in pediatrics, it's not very different than the large adult health systems in terms of AI because of the ROI value. Like it's still revenue cycle, which is not pediatric specific. It's still supply chain, those types of things. So we're focused a lot on AI and revenue cycle for our rev cycle transformation. That's kind of priority number one for us. And then I think pediatric specific, we've seen most of the market is not releasing clinical algorithms predictive. Look at sepsis, clinical deterioration, radiology diagnostics. It's not pediatric specific. So I think that's our biggest challenge, that we would like to focus more in the clinical space. But there aren't off-the-shelf models that we could pick up and even just fine tune. We actually have to co-develop the model from the beginning. So that's a little bit of this pediatric specificity that's a little hard for us to solve for, but we're working on it, kind of
Yeah,
co-develop with some partners.
cool.
Very good. All right, Shakeeb, you've had a minute to think there in the background of your brain.
Yeah, I would say, I think a lot of the industry is thinking about this, David. So I'm thinking, curious your thoughts, and like how you guys are thinking about Epic, Gen AI, especially ambient and art, and that that transition versus
The
contracts
bolt-ons.
people have already been in for a couple of years, and how much Epic is gonna take over and evolve in this space.
So, of course, they're going to build it internally, right? And it'll be just as good with time.
Right.
They're all their ambient stuff's going to be just as good. They're doing everything that's. If you just watch the playbook for the last few years, what happens is you have the bolt-ons, and then we jump on it, and then all of a sudden they come out with their solution, and it's part of the sort of the bulk package. So I think Epic will, the EMRs, no matter, unfortunately, they will continue to be able to get the logos and the customers with time because they just package it all together. And for decision makers, it's just easier to not have another one-off thing to deal with. If you're with an organization that has some budget that you could spend to do things first as an early adopter, then yeah, you could buy the one-offs, wait 5 years, then go back in if the EMR company comes out. I think that's where a lot of folks end up, unless you're one of the early investors in these early stage company bolt-on solutions. Then you probably won't, right? You do whatever you can to stick with it until it exits.
Right.
So I think those are other motives. But yeah, unfortunately, I see the trend of people are just trying to consolidate down, and yeah, it is a EMR vendor sort of centric solution as we move forward, just because it's easier. Not because it's better, because it's easier. Because back to what I said earlier, we got to do other things, Anthony. We got to go out and be salespeople. I
Right,
can't manage technology if I'm trying to sell stuff all day long internally. So I think that's
right.
the other part of the challenge of the role is it's less about technology. It's more about how do you act as a leader? How do you influence decisions? And how do you use these tech to drive something with an organization, whether it's clinical effectiveness or revenue?
Right. And I think it's also, I agree. I think it's also speed. It's like speed and efficiency by which you can get things done. And if it's a centralized platform, that makes it a lot easier, you know?
Yeah.
Shakeeb, let me ask you a little on what your question. Let me follow up on your question to David because I do agree with you. This is one of the most
David,
fascinating.
sorry, you got 2 for 1 because of me.
I'm gonna ask both you guys because this is one of the most fascinating dynamics going forward right now. This ambient Epic niche solution. They were late to the market, Epic. They should have, you would think they would have been the first out with this. So they were late. There's a bunch now of incumbents, as you mentioned. So what I find fascinating is that decision point of what are we using? What's the contract? How much do people like it? What does it do? What does Epic have right now? At what stage is it? How good is it? How do we compare the two? And when do we decide if and when to move? Who helps get involved in that input? How much do the users get input in that? People don't like change. If they've gotten used to a tool, there's certain weighting that has to be given to change, right? So it can't just be as good. It's got to be a little bit better. There's just a lot of factors that would go into if and when that transition was made. And I agree with David. I'm sure it probably will often be made, but it's like when and how do organizations decide if and when? Shakeeb, obviously it's something you're thinking about.
Yeah, I don't think this is any different than what it has always been in this space. There will always be a secondary market of innovators that are building product, and Epic will continue to grow and incorporate other features into its platform. And there's always been this dance of how much are you Epic first or Epic only or Epic if and only, right? I mean, there's multiple ways to play this strategy. In my view, it's a platform play approach. So we are Epic first, but if the solution provides a better competitive advantage for a sustained period, I'm open to other solutions. I do think, to your point, though, it has to be orders of magnitude better, to justify the additional expense, the
Right.
integration, the implementation.
Right.
And so that's just the bar
Hmm.
that other solutions that are competing in this space are going to have to meet. And then if you think about distribution and integration that Epic has, right? Like it's integrated within where the clinicians live today. It's not a second place you need to go do your work. So that is hugely important if you want what we were talking about earlier, adoption and scale. You cannot ask people to go to a secondary place to do their work. So I think this has always existed. It will continue to exist, and the innovators who are orders of magnitude better will succeed. But the bar is high for that in health systems.
And David, like anything else, it sounds like the CIO's role in these dynamics is to educate, guide, try and find consensus, give the input of IT's position on the issue at hand. Here's our position, here's what we see. You're the one that can talk about the integration costs the best. That may not be the most relevant thing to a particular audience. If you're talking about the users, they may say, well, I care about my use of the tool, and you're talking about enterprise wide. So what is the CIO's role when it comes to niche solution, enterprise solution, and making changes?
I think that's individuals' philosophies, right? I think there are CIOs that'll tell their organization, "Oh, integration is tough. It's 5x and it's so expensive." BS. It's pretty easy to do, most of the time, right? It's not rocket science, but you can play that card. Oh, well, this is too hard. I can't integrate. Then the whole organization think, oh, this is too hard. Can I get done? Then you got another someone with a different philosophy that says, hey, I want to push the boundaries. I want to be first to market. I'm happy to try these new things because I know I can integrate them.
Right.
So then you have those two sides, and then depending on the organization's culture and their risk tolerance, I think that's how you're able to navigate. I think the positive side for some of these large companies that have the logos is that's what's helping them innovate. It's not because they're coming up with new stuff. They have the customers. Kind of like Apple, right? I love Apple stuff. Remember how long Apple's been talking about this foldable phone? Well,
Uh-huh.
Samsung's been having a foldable phone for a few years already. Now the rumor is Apple's supposed to come out with one this year. Now everyone's going to jump on it and say, "Oh, what a great innovation from Apple! They got this foldable phone." Well, they're not first to market, just like Epic. They're never going to be first to market, but what they have the luxury is time. They could watch, they could learn from
Uh-huh.
all these third-party vendors and say, "Hey, join my ecosystem.
Uh-huh.
While I watch how you do it, and then let me build something close to it." And then, sorry, we're gonna have a product that competes with you.
That's kind of what happened, right?
Yeah,
Yeah. That's fascinating. Gentlemen, this would be great. Let's get a quick final word of advice, and I'll let you guys go. This was supposed to be all about ROI and AI, but I wanted to enjoy talking about some tangentially related things. So I guess let's go back to that. Let's say, your best advice for a colleague that is maybe having a tough time around this ROI issue, maybe wants to being asked to produce a lot of numbers and a lot of metrics. And what's your best advice to someone that maybe is getting some heat around this stuff? David, we'll start with you.
I'll say best advice is forget the ROI. Just do it. You just gotta implement something. That's probably the key. Just get it out there, get it rolling. Don't focus so much on what you hear about this AI governance because that's essentially just a way to slow things down. This governance discussion, yes, it's required, but I could I could make governance so complicated that nothing gets done for like 2 years, or I can make it very streamlined where it'll get done within a few months, right, or a
Right,
few weeks. So
right.
I think for the CIOs that really want to deploy these solutions, just do it and stop worrying about the governance side of it.
Love it. Love it. Shakeeb, your final thought.
Yeah, I would say don't go it alone, like I said earlier, and really get a couple of partners with you at your level to help define the strategy for you and then get early quick wins. I mean, really make sure that you're deploying some things that are solving pain points for people. So you start getting the stories. Oh, it's not as scary. It is actually helpful. It's driving better results here, whether it's saving us time or improving the clinician experience. Get some quick wins early under your belt, and then continue to build from there.
That's great. That's great. Well, that's about all we had time for today. Regarding continuing education, you can use the link I sent out in the chat box to download a certificate of attendance. There are other links to other health system CIO resources. I want to thank our panelists for spending some of their valuable time with us today and you for attending. And with that, everybody have a wonderful day. Thank you, gentlemen, so much. Have a good day.
Thanks for having us.